What's up? You know what I mean? It was, hey, I was tired. Mark hasn't been able to press. It's always one thing after another.
Right. Welcome, everybody. We'll start in a few minutes. If you wouldn't mind, go ahead and enter your name and the agency you are representing in the chat. Thank you.
But Kimberly, Mark, Jesse, CVR, big CVRN gang. I mean, boom. Let's say those guys. What else? El Campo, eh? El Campo, their affiliates. So they knocked down the apartments. They knocked them all down.
Yes.
All right, everyone, we're going to give it one more minute. We still have some people logging in, but for those who have joined, if you wouldn't mind entering your name and your organization into the chat, it'd be appreciated. Thank you. All right, Tanya, are you good to go?
I am good. Good morning, everybody. I'll let Lindsay start us off, but it's good to see each of you, those of you that have your cameras on. Thank you for joining us.
A few brave faces. Gary, hi. And I just want to confirm, Tanya, you can see the PowerPoint right now, correct?
We can.
Oh, and thank you, Kimberly. I see your office. I appreciate that. All right, everyone. So welcome. For those who don't know me, my name is Lindsay Sisti, and I am a program specialist with the Continuum of Care Division. Specifically, I oversee the Emergency Solutions Grant, and Tanya and myself are excited to have you all on today to discuss the second round of the Emergency Solutions Grant CARES Act funding. Our county was very fortunate to receive quite a large allocation in funding. And as a lot of you saw, we did send out the bid documents were posted through our Continuum of Care website and on public purchasing last Thursday, the 25th. So today we're going to be discussing the documents that were sent out, the goals of the funding, the targeted populations we're looking at supporting, eligible activities, and the available funding for each of those activities, the timeline on the expenditures, and then the minimum bid amounts that we are requesting in your responses. So with that, I'm going to go ahead and move on. One thing I think we want as we go through this presentation today, we really want you to look through a lens of what your agencies have done to prevent, prepare, and respond to the coronavirus back to the beginning of the pandemic. With this funding, we are able to cover expenses retroactively to March 4th of 2020. 20, so over a year ago, that your agencies maybe incurred to respond to the pandemic. For example, if an emergency shelter had to start placing clients into motel rooms while were awaiting their COVID test, that's an expense that could be reimbursed through this funding. So just keep in mind as we go through these slides, keep that lens of, gosh, what have we done that we haven't sought reimbursement from and had to use our general funds for over the last year that could be covered through this funding. With that, I'm going to go ahead and pass it over to Tanya to discuss the goals of the ESG CV2 funding.
All right, thanks again, guys, for joining us. You'll hear us throughout the presentation refer to again, the Emergency Solutions Grant COVID Round 2 funding as ESG CV2. We have not yet replaced that with a cool name like Home Safe or Project Home, but definitely welcome any ideas. So if throughout the presentation you think of a cool name, feel free to type it in the chat box. But we have 4 main goals that really have been established through continuous conversations we've had with our continuum of care partners, our board of governance, and other planning meetings. The first being that we are really looking at using this one-time $32 million when we factor in administrative dollars to end senior, youth, and family homelessness. We believe that we can totally do this. We did it with veterans, and this funding provides us an opportunity to work together. So it brings in an opportunity for government and agencies, local jurisdictions, nonprofit agencies, and other community-based organizations to come together. And so if you've already started reviewing the bid applications, you'll see that there is an emphasis on targeting specific populations. And we'll get to those on the next slide. But again, we are setting a very ambitious goal and going to be working together to end senior, youth, and family homelessness. We can do it. And of course, it is going to require us leveraging other sources of funding, leveraging already existing partnerships with many of your organizations and many of your programs, which again is a unique opportunity. The other goal is to ensure that we have full county-wide coverage across the entire county or 5 supervisory districts. So in the applications, you'll see that we ask for applicants to identify which areas of the county their projects will be able to serve. And we're working with our coordinated entry system lead agency, behavioral health, to facilitate like regional meetings to bring in partners from each of the various areas so that there could be more specific conversations about client needs in each of those areas. The third goal, which is really the biggest one that I think makes Lindsay and I jump out of our seat, aside from like the goal of ending youth and family homelessness, is the idea of like creating a more centralized, effective homeless response system. So the idea is that with the different activities that can be funded under ESG CV2, which we'll get to here in a second, but essentially include emergency shelter, street outreach, and rental assistance, that we will be able to see clients through, youth, seniors, and families through our entire homeless delivery system from beginning to end. So that means from street all the way to the point in which they access permanent housing. And to do that, I talked about the regional meetings we hope to facilitate in partnership with our CES lead agency, but also more coordinated meetings with, as an example, the street outreach teams who receive funding, so that there is regular contact to ensure that, you know, you have one team covering, let's just say, the city of Moreno Valley on one day, and then you have another team covering the Cabazon area. So again, just making sure that we can truly like map out all the resources and know where all teams are at any given time. The fourth goal is one that aligns with the state, is to ensure that this money is used to target marginalized populations. And so think about like those hard to reach individuals, those individuals who are in more rural areas. I think of Mecca, Thermal, and other parts of the county, even like Anza, which again are just harder to reach, but would allow for individuals who are very vulnerable, at risk, to still be able to access our services. If we can jump to slide number 4. Again, while our goal is to end homelessness for 3 populations, we've looked at our data in HMIS, the Homeless Management Information System. Many of you may already be familiar with HMIS. Any street outreach team, emergency shelter, or existing homeless service provider that receives funding from HUD, the U.S. Housing of Urban Development, or any other state or federal dollars that target homeless populations, are usually required to enter their client level data into HMIS. HMIS is great because it allows for us as providers to get a historical snapshot of, you know, which clients are already in our system and what services they are accessing. So through the use of that data, and also our existing by name list that is maintained by our County Behavioral Health CES lead agency, we've identified that the biggest needs are for people who are in congregate and non-congregate shelter. The reason for this, right, is emergency shelter is meant to be brief. Our goal is always to basically place people into emergency housing and as quickly as possible link them to permanent housing. We want to be able to ensure that people who are on our CES by name list today can receive access to permanent housing. And so we're going to use funding from this program. So if you apply for rental assistance, as an example, to target those individuals. We're also targeting seniors. We've learned a lot about this population through our County Office on Aging Department and our Adult Services Division through DPSS. And again, want to make sure that we continue to target them in the near future. We talked about youth being also a very critical population, and we've seen some dramatic increases in the number of youth that experience unsheltered homelessness. We're also hoping to target families with at least one child under the age of 18. We talked about marginalized populations who are experiencing homelessness, in addition to veterans, right? Like we reached functional zero in veteran homelessness back in 2018, but we know that in order to sustain that benchmark, any new veterans who enter our homeless delivery system need to be fast-tracked to permanent housing. And a big one that we discussed, I know about 3 years ago, after we did our 2018 point in time count, was looking at the number of unaccompanied women who are experiencing homelessness, because we have definitely seen an increase in that population as well. So if you're already serving those populations, actually, as a matter of fact, I know many of you already are, that's great, but know that our plan is to work very closely with our CES lead agency so that when any agencies or any projects that receive funding through ESG CV2 are ready, right, to take another person or to take another referral from the by name list, that we would ensure that they fall into one of these categories, right? So we're going to be very specific and say, okay, as an example, nonprofit number 1, you have 20 vacancies. When you submit your referral request to CES, let them know that these are the populations that you are targeting. And Lindsay is going to take it from here. She's on mute, but will unmute herself here very shortly.
You know, I was talking. Thank you. I appreciate you letting me know. So everyone, so now we're going to jump into eligible activities under this funding and available funding under each activity. And we'll get down into more details of what types of activities can be funded, but there are 3 overarching eligible activities that can be funded with this ESG CV2 allocation. The biggest one is our emergency shelters. This can be for our congregate as well as any non-congregate shelters that have popped up really as a response to the coronavirus, such as Project Roomkey, and I know there's others out there as well, so that our more vulnerable populations could be housed in isolated settings. We have our rapid rehousing. We have $13.5 million that are put into rapid rehousing. These 2 categories, the emergency shelter and rapid rehousing, were really those are being prioritized by the state, so that most of our allocation is going into this. The state came and said, look, we're not going to do homelessness prevention with this funding. We need to first make sure that every homeless person in your county is getting housed and where they're going to be the safest. So that's why we see such large allocations under emergency shelter and rapid rehousing. And then for street outreach, we have just shy of 1.5 million available to bid on. If you've had a chance to see the email that went out last Thursday, we did send out the bid notification, and it's also posted to our public purchasing website. But if you did not get that or are interested in receiving these documents, feel free to reach out to myself. And I can send them over to you. But we released 3 bid documents. We decided to do a separate document for each of the eligible activities, since we're talking such a large amount of money. So the first activity, again, was emergency shelter. And the process we're doing is not the typical RFP process. We're doing a letter of intent. The letter of intent is a very short document. We wanted to make it as easy as possible for emergency shelters to apply for this funding. And then for the rapid rehousing and street outreach, we created 2 separate invitation to bid documents. In these documents, our team really outlined what we are needing, including, as Tanya mentioned, the target populations we're wanting to be served and the full coverage we're wanting to identify which districts you're able to serve through these documents. Just as a reminder, the responses to this bid, it's a really quick turnaround just because we're on such a short timeline. They were released on the 25th, and all responses are going to be due back by the 8th of April by 1:30. Those just need to be submitted electronically. We don't need those hand delivered to our county purchasing office. So we're going to jump into our first funded activity, which is emergency shelter. So again, The ESG CV2 funding can support both congregate and non-congregate shelter. Just like your normal ESG funding, it can fund operational and essential services for these shelters. And then there are also additional expenses that are very specific to the ESG CV funding that shelters can get funding for to prepare and prevent and respond to the coronavirus. Some of the corona-related shelter expenses are listed here. So any supplies, PPE, bed linens, hand sanitizer that has been purchased since the beginning of the pandemic can be billed towards this funding. Food, including, and if you've switched your meal delivery service to include individually boxed meals, can be covered. Water, snacks, if you needed to purchase more cots because you've needed to expand your shelter to allow for social distancing, or room dividers, those are all going to be eligible expenses. In addition to the essential services of case management, health services, and then transportation. I know a lot of shelters have been transporting clients to go get tested, to go get their vaccination. So transportation expenses, purchasing of vehicles, those are all eligible expenses. And if you do look at the letter of intent that was released last week, it has a very thorough breakdown of all of the expenses that you can request funding for. And with that, Tanya, I'm going to pass it to you for rapid rehousing.
Perfect. So most of you might already be familiar with rapid rehousing. Rapid rehousing provides or includes rental assistance for up to a 12-month period. I will say that on a state level, they really want us to use a model which we refer to as progressive case management, so that the level of rental assistance that is provided to each household or each individual varies depending on their need. And that need will be determined based on the interactions that your case management staff have with that family. And I think most people, when using rapid rehousing, use a scattered site model, which basically consists of identifying private rental units that are willing to take payment from a third-party agency, such as yourselves, and may be distributed throughout an area of the county, or in this case, because we are looking to target supervisory districts, may target an entire supervisory district. Or if you're a city and looking to partner with a local nonprofit provider, that rental assistance may target clients or landlords in your local area. So in short, rental assistance or rapid rehousing funds can be used to pay for those costs, and those payments, of course, are made to the owners. They can also be used to pay for moving costs. So those of us that have done a lot of outreach to encampments know that our clients usually come with a lot of stuff, but so do I, Like moving, for me, usually takes more than one trip. I think about the last time I moved, my husband wasn't too happy because we had to keep the truck a little longer than expected. But in short, you can pay for move-in costs, which is really, really nice, so we can make sure people can take their stuff with them. You can use it to pay for storage. How many times, have you secured a rental unit for a person, or perhaps you're bridging them from emergency shelter to permanent housing, but you're waiting for that unit to be ready? You can use these dollars to pay for storage fees. Again, a major plus, and we would strongly encourage you guys to include that ask in your request. You can also use it to pay for utility deposits, electricity, gas, so all your essential utilities. Unfortunately, like not TV expenses, not phone expenses, but your essential utilities that you need to live and breathe. Although as I say that, I don't think I'd be able to breathe without my phone. But okay, rental assistance up to 12 months, utility payments up to 12 months. As I mentioned earlier,
security deposit in California.
Say that again, Susan.
Sorry, I didn't know I wasn't on mute.
It's all good. I thought you were helping me out here. I was like, please chime in. You are a pro. So utility payments, as I mentioned earlier, you want to use progressive case management to determine, okay, what can a client pay towards their utility payments, and what would be the difference that they need to make the full payment. And then the cool part, right, is that you can use this money to pay for landlord incentives. So you can pay for a signing bonus up to 2 months of rent. So that's different from the security deposit, which I think is where Susan might have been getting at. And then in California, you can, there's a restriction that allows you to pay for up to 2 times of the security deposit. With ESG CV2, they're saying, hey, pay more, pay up to 3. Like, let's get people into housing, because we know that we are very much competing in a very tight rental market. And then you can also use this funding to pay for minor repairs to make the unit move-in ready. So think about how many times you've gone with a client to go tour an apartment and it is just not ready. It needs to be cleaned. Maybe there's a leak in the bathroom. It's not going to pass inspection. You can work with the landlord to pay for these costs, and use it also to pay for appliances such as refrigerators and stoves. Again, whatever is needed to ensure that that unit is safe and habitable before move-in.
Perfect. And one other thing I did not include on this slide, which I think is important to note, and I know it tends to be a barrier when trying to identify a unit, but for the second round of ESG funding, we aren't limited to the fair market rents. So traditionally, the rent amount that can be approved the gross rent can exceed the fair market rent. For ESG CV2, they waived that, and the rent just has to be reasonable compared to other units in that area. Obviously, the purpose of using the fair market rent is to make sure you're not putting the client into a unit that they're not going to be able to sustain the rent on. So you have to keep that in your mind, but you're not going to be contractually bound to keep the gross rent at the fair market rent.
Thank you, Lindsay. All right, let's jump into street outreach. I know we have some street outreach teams on the line, and you're probably anxious to hear what types of expenses are eligible under, again, ESG CV2, still looking for a cool name. But you can use ESG CV funds, of course, to pay for your staffing costs. Traditionally, and what we see throughout the county is that most of our street outreach teams tend to travel in pairs, which I think is good, a good practice to keep in mind, especially for safety. But looking at the first bullet point, right, so you can use these funds to pay for any type of engagement services, your staff. The new thing, which is also noted here, is that you can use it to pay for like portable bathrooms, portable hand washing stations, portable showers, right? With COVID-19, and we're beginning slowly to see businesses reopen, but of course not in the same way. A lot of our unsheltered individuals would normally go to Starbucks to access restroom services or charge their phones. And so, right, keeping in mind now that with those services being gone, you could totally use these dollars to pay for those types of things. And we want to encourage you, especially if you're a city, if you're a nonprofit agency, to partner with your cities to see how you might be able to make those types of services available. It can be used to pay for PPE. And then also hiring vaccine ambassadors to help educate individuals about getting their vaccine. So kind of a new role that we, or a new title, right, that we would have for the first time in Riverside County. We talked about case management, but this also means like ensuring that, right, referrals are happening so that people are accessing medical care, and we're arranging delivery of other, much needed services. That could be behavioral health services or referrals to like a recovery program. You can also use it to pay for emergency health services. So this is big, right? A lot of times, street outreach teams, we want to make sure they have tools to, whether it's purchase medication. Sometimes individuals, street outreach teams will facilitate the connection to a medical provider, and the client walks out of that appointment with a list of prescriptions, but no resources to pay for those prescriptions. So these dollars can absolutely be used to pay for those types of costs. And transportation. I know we say train or bus tokens. Uber's a big one, right? Like many of our teams are beginning to use Uber to get people to and from appointments. Whatever service you use, and Uber's not getting any points, or they're not giving me any points for using them on or giving them a shout out on this training. But any transportation costs could fully be covered under ESG CV2. And so here we just wanted to give you some additional examples of other types of activities that could be used under the street outreach component, which could include, right, a space that you lease to host a vaccine event. We're beginning to work more and more closely with public health, there might be an opportunity here. I'm thinking about our shelters who already partner with, whether it's Borrego Health or another healthcare provider. You may want to brainstorm with them to think about, hosting a vaccine event for a community in your area. You can also use this funding to support volunteer incentives to stand at that event, right? You might need people from the community, or you might want to use people from the community to help you put that together. You can use ESG CV2 funding for incentives. We talked about transportation to get people to a COVID vaccination appointment. Hazard pay, which can essentially is used to increase pay to essential workers who are providing direct assistance to individuals who are at risk of getting COVID-19 or are COVID-19 positive. You can also use it to pay for training. So training to your staff, right? I'm thinking a lot of you are maybe looking at hiring new staff to carry out these activities. You can absolutely bill that time to this grant. In addition to, think about any trainings that you might host for the community, the people that you're serving, on whether it's COVID-19 or related healthcare topic, absolutely could be used under this program. In addition to motel rooms for clients who need to isolate while they're pending their COVID-19 test results. And I know from speaking with providers such as Coachella Valley Rescue Mission, Martha's Village, and others that, right, they have very close relationships with the hospital systems in their area, so they may be receiving individuals who need to be quarantined for a period of time before they can, be bridged into the regular shelter system. So those costs can absolutely be built. And what I will stress, and I think Lindsay stressed this at the beginning, is because the program period actually started in March of last year, even though we just received and we're still waiting for our standard agreement this year from the state. If you have already started some of these services, they started up in March 2020, you can absolutely, and we want to encourage you, request reimbursement for those costs under this program. As long as they have not been reimbursed, right, through another program. So if you use general fund money, donation, right, funding that you've received to pay for these costs up front, we can absolutely reimburse you under ESG CV2. And with that, I think I'm going to hand it off now to Lindsay.
Yes, thank you so much, Tanya. And we will save room at the end for Q&A. So I'm sure lots of things are popping up as we go through this information. So the next point we want to discuss is the minimum bid. So as you know, we're dealing with a large amount of money, $31.589 million. So we did set pretty high minimum bid requests. And a lot of this is so that we make sure your agency has the staffing capacity to really support these households, that you're really up and ready to go. So for emergency shelter and rapid rehousing, we are requesting $500,000 as the minimum bid. We don't have a maximum set for the request. And then for street outreach, 200,000 is the minimum bid that we're wanting to award out. Now, with that being said, if I know there's fairly tight expenditure deadlines, which we'll get into that next, if you really feel that you can spend a large amount of money, but maybe not quite 500,000, I still encourage you to submit a bid, and those will certainly be considered when we're reviewing the bids that we receive. And then the last slide we want to highlight is the expenditure milestone. So as we've discussed, this project really started at the beginning of the pandemic, and we're using, again, the date March 4th, 2020 as the start date. The spending milestones are set by HUD, so we're pretty tied to these at this point, but 20% of funding awarded needs to be spent by July 30th of this year. 40% of the funding needs to be expended by September 30th of 2021, 60% by November 30th of 2021. And then this next box is critical to note, especially if you're an emergency shelter provider. For emergency shelters, that program is shorter than for rapid rehousing and street outreach. So for emergency shelters, 100% of this funding received through this program has to be expended by January 31st of 2022, whereas for rapid rehousing and street outreach projects, you have until August 31st of 2022. So we really wanted to make sure that was clearly pointed out here, that for emergency shelter activities, congregate and non-congregate, this funding only supports those through January 31st of 2022. So with that said, that's all the slides that we have, and I think we wanted to open it for questions at this time. And if we're not able to get answers for you now, we will certainly do our research and make sure we get the information you need.
I see that Karen Roper has her hand raised. Hi, Karen. Thank you for joining us.
Hey, Tanya and team, good job. I know this has been a lot of work for you guys to pull together in a short amount of time. So congratulations. This is a super exciting opportunity. If I missed this because I came on late, I apologize. Knowing that there's this super short deadline, I was just thinking about something creative, and I don't know if this is possible, but especially with the bucket of money for housing, is there a way to prepay a certain number of months of rent in advance so that you could commit the funding if you were able to negotiate that? Let's say a nonprofit was able to negotiate that with a willing landlord. is that something that could happen? Because you would be able to obligate a larger chunk of money quickly to draw down.
And I can definitely respond to that. And I'm pulling up, I actually reached out to the state hoping that there would be some flexibility on this subject. Unfortunately, they do not allow the prepay of rent with this funding, and it has to be paid on a month-by-month basis.
Well, you know what, Tanya, we're just gonna, on the policy advocacy and through the continuum of care, keep pushing for policy changes like that.
Yeah, and you know what, Karen, we have been able to do that for an example, like with the HEAP funding, that is much more flexible, but we see that with state funding, right? ESG is a federal program, but I'm so glad, Karen, that you did create, that you launched the policy and advocacy committee, because you're right. I think we could make a really strong case to HUD. The last time I looked at our vacancy rate, which was, our rental vacancy rate prior to COVID, we were at, 4% countywide, 4 to 5%.
Yes. Yep.
And with COVID, we know that has definitely shrunk. I don't think there have been any studies yet to see what that is, but we're all feeling it. And agree with you that is very much needed. The good news, Karen, I just want to make sure you didn't miss it, is that there are some other incentives we can provide to the landlord that we've never been able to do before, like 3 times of the rent towards the security deposit. And we can also use it to provide, I want to make sure that I use the right wording here, the signing bonus. So a signing bonus up to 2 months of rent. So essentially a landlord could receive up to 5 months of rent, right, up front.
No, that's fabulous. Honestly, I was just thinking of spending strategies so that our continuum of care performs well and that we don't set up our nonprofits for failure, because with pent-up demand in the housing market, and the vacancy factors that you're talking about, it's just going to be challenging, and housing is so desperately needed. So, but that is phenomenal. And I saw that you guys were building in those where you could with the state guidelines, the flexibility. So thank you. I knew it wasn't on the county's end. So thank you, Tanya.
Great question. Any other questions? As you're thinking about your questions, I'll chime in and say here, one, go big with your ask. This is definitely a time to dig out your wish list that you created a year ago, 2 years ago, 3 years ago when you first started working in homelessness. For some, like Karen and others, I'm thinking of like Robin, who's also on the line, who have been doing this for many, many years, right? Like go back to 10 years ago and, use that to put your proposal together. We also want to strongly encourage collaboration. So for cities, we actually sent out an email to every single eligible city to say, hey, this funding is out there. We want to encourage you to apply, but we also want you to partner with a nonprofit supportive service provider who has experience, because as we know, the rental assistance is as an example is a very critical piece, but you need those ongoing case management services, direct services to ensure that our clients reach stability, and that at the end of the assistance, they're not returning to homelessness. So dream big, think about partnerships. If you need help, facilitating or connecting with, or determining like who's a local supportive service provider in our area, we can share our continuum of care member list with you. It might already be on our website. People can absolutely share that with you, so you can begin to reach out. In our mind, right, this really, in addition to like centralizing our homeless delivery system, also allows us to create, like for the first time ever, a large multidisciplinary team, like homeless services team. So for those of you that are truly interested, like we very much look forward to working with you and having regular contact with you to facilitate the different pieces of your operations and meet the needs in each of the areas. Gary, I see your hand raised.
Hello. Hi, everybody. Tanya, Lindsay, thank you so much. Great presentation. Super excited about the opportunity. So I am just trying to get, I think, a bit more clarity on sort of emergency shelter funding. And it reads, and I think the presentation sounds a bit like it's mainly geared towards existing congregate and non-congregate shelter providers. There are some pieces that sort of resemble kind of case management, but in a way that sort of wraparound case management-y piece, either if it's going to fit into the emergency shelter funding pool, needs to be in partnership with an existing kind of emergency shelter, or if not, it could be a bit more standalone under the rapid rehousing kind of funding stream. Is that a good, you're nodding, so that's helpful. That's a good way to think about kind of how case management, like even longer term kind of case management, would fit into either of those two funding streams?
Yes. So absolutely. And I really like that you raised the question the way you did, because I think that's good for people to know. So as an example, if you are an existing provider of an emergency shelter, you likely already have staff on site who are facilitating case management services. But it may be a very specific type of case management. For example, right, sometimes you'll see like a housing specific case manager. You also see like a medical case manager who meets, you know, like medical healthcare specific needs. And everything that we're hearing from the state is one, speaking to that there's a broad range of, we recognize there's a broad range of services that people need. And so this truly provides our existing congregate and non-congregate emergency shelters to look at ways that they can expand partnerships with other agencies to provide more of those specialized type of services. So I think about, right, aside from like medical and like your housing case manager, that, right, like one could make the argument that, hey, we have a large emergency shelter program. We need a designated like youth case manager that comes in and speaks to the needs of youth and maybe provides like more peer type of case management or life skills types of case management. So you can absolutely use this to expand your existing teams. Lindsay and I sat on a conference call where the state is really pushing to use a lighter client or staff to client ratio. I think where traditionally we have seen case managers carrying a caseload of anywhere from 30 to 40, sometimes even 50 cases, they're saying look for 1 to 15. Right, so we can make sure that we're, again, connecting people to those specialized services. So, so yes, you can tap into an existing emergency shelter program. Think about like Project Room Key, right, would be an option to coordinate with the housing authority to say like, hey, we think we, or we know we provide a special service to your clients. Tanya reached out to us when Project Room Key first started and asked us to like help you, like how can we start not only getting compensated for the work that we did, but also like, right, look at the future of Project Room Key and that non-congregate shelter program to ensure that we're able to sustain our teams and provide those critical services people need. I'm looking at my notes just to see if there is anything else. Any other questions from folks on the line? Do not be shy. You're welcome to type your question in the chat box. Just so you know, we will be posting the recording of this webinar training on our website. And we will also be sharing the PowerPoint in an email to the entire continuum of care. We hope that you will help us spread the word and encourage folks to apply. And I see somebody typing in the chat box, just thank you, thank you. We thank you too for your participation. I think, Lindsay, if you feel like we're at a good place, we can go ahead and wrap up. If folks have questions after this session, who do they contact, Lindsay?
Yeah, so contact for myself, I will go ahead and put my contact, and then Scott, who I see just jumped on a little bit ago, Scott Haddon. If you could send questions to both of us, because we are also forming a Q&A to post on public purchasing. So your questions, I'm sure, are questions that other people have. So, and Scott, you're on the call. I think your email is just Scott Haddon.
Yeah, it's shaddon@rifco.org.
There we go. So if you wouldn't mind, if you have questions, if you could include both of us on that, and we will respond to you as quickly as possible. We've already been getting quite a few questions, so.
All right. The other, I think, just additional note, if you are participating in any meetings in the future and feel like that would be a good or serve as a good outlet for us to get the word out about this funding, please contact Lindsay or myself. We'd love to be there again. We really just want to make sure that these dollars reach the entire county. We don't want to leave anybody out, which is, again, why we made an effort to email each city and encourage their participation. If you haven't already, I would strongly encourage you to look at the application process. I know that in the past, our applications have been very lengthy. In this case, because we are taking a more specific, right, like we're very specific about what we're looking for, our target populations, and how those each of the teams will work together. We were able to work with Scott Hayden from County Purchasing to, simplify the application process. So we hope that that's a major plus. And again, another reason for that is, I think Karen made the point, we really just want to make sure that these dollars get out into the community as quickly as possible. So thank you again for joining us. We appreciate you, and we'll make sure to share the PowerPoint with each of you after this meeting. And please do not hesitate to reach out to, I see Lindsay and Scott included their email addresses in the chat box if you have any future questions. Thanks again for joining us.
Thanks, everyone. And April 8th, 1:30 p.m. due date. Okay, don't write that down. Put a big star next to it on your calendars. Have a good day, everyone.
Hey, thank you. Have a good day.
Bye, guys. Tanya, you want to stay on for a second?
Yes, I can. Sounds like I'm in trouble.